topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good afternoon to the most beautiful state of Oregon. Hey, welcome to another Ask the Expert show where for the last 16 years, we've brought you the top experts in the field of legal, health, financial, and home improvement. It was so hard trying to find somebody who had a longer last name than me, but we found somebody. We're just going to call him Dr. K today. I actually call him Chris. Good afternoon, Chris.
Hello. Nice to see you. Thanks for having me back. Great to be here.
So if I see a grizzly bear come up from behind you, should I say something?
Exactly. Just give me the heads up. So I'm casual today because, as you know, it's Veterans Day. So thank you for
Yes.
everybody that served. I'm a veteran myself, and yesterday was
Oh,
the 250th birthday of the U.S. Marine Corps.
Marines.
Yep, and I did serve, so I was what's called a SARC with Force Recon. So I'm rocking my gear today casually in the clinic as a homage to my younger, scrappier days. But thank everybody for their service.
Hey, thank you for your service. So you're a Marine, Chris?
I was a what's called a Special Amphibious Reconnaissance Corpsman. So the Marines are still technically part of the Navy, and the medical
Right.
people, the corpsmen, can be assigned to the Navy, to the Marine Corps. So they're green side corpsmen, and I was fortunate enough to make it and be selected into special operations. So I was able to serve with their force reconnaissance teams in my much younger, stronger,
Amazing.
scrappier days.
Yeah, I hear that. Well, you have built up quite a practice, Chris. Tell people about Upgrade Medical.
So yeah, so it's at its heart, it's a functional medicine clinic. Which encompasses a broad range of treatments. We focus on longevity and wellness and optimization, but I do the 17 years prior to this, I did a lot of complex chronic disease and pain. Um, and so we still do some of that, and we attempt to find, the root cause of issues while still dealing with people's symptoms and get them on track.
Wow, I got to tell you, you've done such an amazing job. And today, we're going to be talking about longevity,
Yeah.
anti-aging. But I got to ask you this because, we start promoting your show a few days out, and I always put functional medicine on there. I probably got about 20 emails asking me what is functional medicine. So why don't we start there first?
So yeah, I mean, functional medicine is more of just an approach, right? And it's become a sort of system. And the difference between it's still science based, it's still medical. It's just a little bit different approach. It strives to identify what are causing the underlying dysfunction. So some people use the term root cause, some people use the term, underlying factors, some people, right, the cause or source of whatever the dysfunction is. And it's takes a systems level approach. So instead of a linear approach, which frankly Western medicine is far better at, right? You have a heart attack, you get hit by a car, you're right. you want to go to the hospital. You're not showing up at my clinic. But
Right.
for these enormous or amorphous sort of states that a lot of people have, where they just can't figure out what's going on, or why am I tired? Why am I whatever? Don't feel well? Why is why my GI system,
Yes.
etc. We try to take, make everybody essentially a Venn diagram, do extensive timelines, extensive histories, try and interrelate all those things to identify which systems can be our primary target to correct. And then we start moving in that direction. So you could think of it like peeling layers off an onion until we get to the heart of the matter.
Yeah, but you know what, Chris, from the letters I've read, what's really amazing is people who went and saw their doctor and they just knew something wasn't right in their system. And their doctor did blood work and said, everything's clean. There's really nothing wrong with you.
Yeah.
And then they come to a doctor like you who specializes in functional medicine and you get to the root cause.
Well, we try, that's for sure. I mean, some of it's philosophy, right? Of how you interpret it. When you go to the Western doctor and you get your screenings and you get your, right, all those things, those are important because we have solid data on population-based norms and averages, right? We have extensive amounts of information on that. And so we know that, for the majority of people, XYZ equals whatever. And that we should screen for colon cancer at this point, and we should screen for breast cancers at these points. And we have that data. Does that data change? It does as science evolves or we find mistakes or whatever the case may be. But they're using population-based approaches, whereas we're using individual approaches. So when I look at somebody's labs, I'm narrowing them down into what's really optimal, right? Because in a bell curve, a C minus, D plus maybe, depending on what school you went to, is still passing. But you don't want to be passing, right? You want to be an
Right.
AB, right? And that's sort of the philosophical approach. Is I want to move people who are, yep, they're normal. They're sitting at a C, C minus, D plus. I want to move them into the optimal ranges of things in terms of lab work.
Gotcha. So today we're going to be talking about longevity, anti-aging. So when I say longevity, what does that mean in your practice?
So let's talk about this. There's some, because definitions are all over the place, right? And you have people hawking all sorts of stuff. So I sort of categorize things as like longevity, wellness, and optimal, right? The longevity is living long. Of all the technology we have, we can extend life, but it hasn't been a significant expansion, right? We're not at 150 years, 200 years, right? We're eking up, but the average lifespan hasn't significantly improved from the time we, sort of got antibiotics, really. And then, of course, there's economic and social and geographic issues around that. What we know about longevity is a couple things, depending on who you talk to, super caloric restriction is consistently shown to improve lifespan. Doesn't necessarily mean you age well, right? So those are kind of the differences between just longevity as the definition versus living well. So I sort of take longevity and wellness and put them together. When you look at longevity in terms of the science, there's 3 indices that predict how long you will live. That is your VO2 max, so your cardiorespiratory fitness. And we know for most people, that means regular exercise, ideally high intensity interval training, if they can do it. Otherwise, cardiorespiratory. Muscle mass, right? Typically, measured surrogately by grip strength. The new sort of thought process is calf size in terms of muscle mass. And we want a D-shaped body curve, right? Low weight, high muscle, low percent body fat. It's like in a D-shaped curve if you took those three things, right?
Right.
And then the third indice in the straight literature, it tends to be insulin resistance. I personally say it's all of your metabolomics. So insulin, your metabolic factors, your inflammatory factors. I personally, look at all of those markers as one in a functional set. So I think it's sort of the metabolomics as a whole function. And then, well, I guess there is a fourth one, and that's when you need your kids' help to use your phone. That's your mark of aging. That is your true marker there. No, that's a joke. The longevity, you have those three sort of longevity indices, right? And within those, especially the lab work, there's several. If you add wellness to that, right, now you're talking about, okay, this gets us to live long. How do we live well? And so that's where adding some of those other labs come into play, i.e. hormones in particular, growth hormones, testosterone, estrogen, progesterone, thyroid, right? All those kind of things. Your pillars of health. Do you have quality sleep? Are you getting enough deep sleep? Is your mental health or your spiritual, spiritual practice intact? I mean, do you have anxiety, depression? Are you isolated socially? Those things need to be addressed. Is your diet good? And are you exercising, right? Which then, of course, loops back to the other two indices, right? And so that's sort of how I incorporate it. And then optimal is more of the philosophy of an individual's provider's approach. It's medical science, but you're applying it philosophically. So I'll give you an example. There's age-adjusted ranges, lab ranges, for hormones, right? So
Right.
if you took a older person, which at this point is me, and you did their labs and it said, okay, well, you're in the average, you're older, your testosterone's going to drop, your growth hormone age adjusted is in the right place. That's age adjusted data. And so that's normal. I don't consider that optimal, right? So if we extrapolate when was our peak optimal physiology, that's kind of what we're aiming for. Now, are we always going to make somebody a 27-year-old? No, of course not. But the goal, the concept is to move those things into optimal ranges. And then that requires some skill and nuance because you want to ameliorate any potential risks around that, because as we get older, you also get other risks. But then by doing that, you decrease other risks. So if you put those things together, and if it's done properly, ideally, we're getting the longevity, the wellness, and the optimal.
I have got to read this. This just came in. I saw where your show was coming on. This will be the third show I've watched. I am a local DC downtown Portland
Great.
doctor. DC is what?
Chiropractor.
Is that okay?
Chiropractic.
I just
Yep.
want you to know he says, I practice holistic medicine, and I just want you to know you are so right on. What a compliment.
Thank you. That is a
That
compliment. I
is nice.
appreciate it. And all the people doing various things, like I love chiropractic myself. I go
Yes.
pretty regularly. I have a terrible spine. It's deteriorated, which is ironic for a chronic pain functional medicine guy, but misspent youth and all. So I do a lot of these things myself. I replace my own hormones. I use a variety of peptides. I go to chiropractic regularly because I don't want to have to be using meds as often as I would need without that. I exercise, all of those things. So, I try to practice with what I preach. We're, just don't call my wife. She'll tell on me.
Do you
But,
use the pellets, Chris?
I do. I
Chris,
have
do you use?
pellets
Oh,
myself. The gold,
I've heard
the
really
gold
good things.
standards. Yeah, the gold standard is still injection. There's topical, which I don't prefer for men.
Mhm.
Though there was some good data about applying it to the testicles, but I don't think it's necessary. The gold standard is still injection, and there's a few ways to do that. Um, but we're seeing that getting a more even distribution and consistent level is better. And then that makes the injections harder because you have to inject more
Mm,
frequently, right? And their
right.
muscles. So some people doesn't bother them. Me, I'll tell you, I would have forgotten half of them. So I just put pellets in myself. Um, and then there's some new oral testosterone that's appearing to be safe, but pretty expensive. Um, but we even replaced testosterone for women. It's a common deficiency for women, and I am personally also not a fan of just blocking estrogen outright in men to non-detectable levels, like a lot of, let's say, online and influencers might recommend. We're all organisms, male or female, need all the hormones just at different levels, right?
Uh, Larry in Vancouver, I really am enjoying your show. When it comes to longevity, what supplements do you like to use?
Hmm. So I have to be a little careful because I can't give medical advice over
No,
over the
right,
over the
exactly.
the radio. I mean, generally, I would say, particularly in the Northwest, the majority of people are going to be vitamin D deficient. That's number
Okay.
one, and we do want to keep vitamin D's at certain levels. Common deficiencies, women, premenopausal women have a higher incidence of iron deficiency, whereas men have a little too much iron, whether it's meat or genetics. Um, a lot of people are magnesium deficient. That's pretty well documented. I would say um, fiber actually is
Mm,
very, very commonly ignored. And fiber does a lot. It feeds our microbiome, it lowers cholesterol, it binds toxins, it helps move things through our digestive tract, it makes us full and not eat so much, it lowers glycemic load, spikes when after eating. So I would personally put in fiber, and fermented foods, probiotics. Multivitamins and things are fine. I mean, we probably are micro mineral deficient pretty often because our food sources are tend to be low, but also a lot of our foods are fortified. So we don't need to excessively do it. I tend to target my supplements via labs or condition or symptom, and prefer people to get the majority of their nutrition through food. So I do like things like, I would say a lot of people are omega-3 deficient as well because we just have higher amounts of omega-6 fatty acids in our diet. So things like fish oils and flaxseed oils are better. Avocado, your good fats, but particularly the omega-3s. Uh, And I would say probably antioxidants. We're under a lot of oxidative stress, systemically. And so that's why we eat things like bright fruits and vegetables, right? And so there is things like, there's a variety of like organic greens powders and superfoods out there that have, I like to use those. That's what I use myself as a multi, because you get your extra serving of fruits and vegetables. It usually has some superfoods in it, your nutrients, etc. Throw some fiber in it, and smoothie it up.
Uh, Jerome wants to know, how do you measure hormones? Is it better through blood tests or saliva?
So It actually depends on the hormone. So things like cortisol are better measured in saliva. Uh, and it depends on which form you're going to do. Standard, I would say for the most part, I'm utilizing blood, except for adrenal things where I use saliva. There are, however, instances where dried urine, which is called Dutch testing, is appropriate.
Mm.
I like that for women, especially to make sure that things like the pathways are intact, or if we have a problem that we need to identify, it's just a much more comprehensive test. One thing I will say is, whatever you're doing, you should, and if you're intervening based on that lab, you should make sure that you're testing with the consistent, so same lab, same type of lab over time, so that you're apples to apples. And then if you're going to make a change, or your provider's going to make a change, then from that point, that's kind of a new baseline in terms of testing.
Craig wants to know, does insurance cover your services? That's
It
a
does
good question.
not. It does not. It's even when I had a clinic that took insurance,
Shame on
which was
them. Shame on the insurance
right.
companies, Chris. Shame on
Well, for
them.
sure. Yeah, for sure. I mean, we have, there's so many things we have available. I have access to a test called the Gallery. I don't make money off this. The Gallery test, which is a very advanced pre-cancer screening test. It'll identify 50
Mm,
cancers and location well ahead of whenever we would be able to detect it otherwise. We have whole body
wow.
MRIs that can identify things that are proprietary MRI that will identify small things again before most of the time they'd be caught. I mean, imagine just those two tests and a comprehensive functional blood panel, what that would do if we were doing that annually for everybody,
Mm.
right? That's
Uh, yeah, I want to. We're starting to run out of time. I want to get this question in. I'm interested in coming in and seeing you.
well,
So
thank you.
longevity is important to me. Yeah, longevity is important to me, not just by how long I live, but the quality of life I have. What is instilled? I don't know if that's the right word, but you meant, but coming in and seeing you, what do you test for?
Well, some of it depends on the patient's goals, but I can test for anything.
Right.
I have a very comprehensive standard blood panel that I do standard, but I'm going to take out basically all your blood because I'm going to run every lab imaginable. And then I'd say a good middle ground is something like an organic acids test that identifies nutrients and inflammation and things like that. And then, if you've looked at longevity, biohacking, any of this stuff, right? It's a pretty deep rabbit hole. So you can get
Yeah.
pretty crazy, but we can test for anything, right? We can test. There's various aging calculators. There's gut microbiome analysis. There's advanced disease risk analysis. I mean, there's everything. But I would say typically I do comprehensive blood work with the nutrients, unless there's a reason to do beyond that. And I'll tell you why. It's low hanging fruit, right? Those are really easy things to address. You have these nutrient deficiencies, you have this much inflammation, your hormones aren't optimal, your cholesterol's too high. Like that's low hanging fruit to intervene. A lot of people want to go right
Right.
to the top of the pyramid, but you or sit on the chair, but it's easier to sit on a four-legged chair than a three-legged one, right? So, or whatever, I don't know, I was trying to think of an analogy off the top of my head, but you get the picture, right? You have to have a solid base to work from. And so that's why it's just my opinion, that's why I approach it that way, because that's low-hanging fruit. It's easy to intervene on, and it gives people time to sort of develop those habits, right? If they're coming in to utilize equipment, right? They start exercising, they're coming in for red light, they're getting pulsed magnet, they're whatever, and they're developing those habits over time. Now then you go to the next level, right? The refinement. And right? And things like that.
Chris, your show goes by so fast. Tell people how they can call and make an appointment, and also give them your website.
Sure. The website is www.upgradepdx, like Paul David X-ray, the abbreviation for Portland.com. And the phone number is 971-299-8350. I do not answer that, but I will get back to you. It is also textable. There is free discovery calls available, 10-minute calls on the website. But if you're interested in scheduling, you can also just click new patient inquiry and schedule a personalized lifestyle visit.
Chris, I love doing the show with you. Chris will be back again with us next month. Your shows always go by so fast. Chris, have a wonderful Thanksgiving. We'll see you next month.
Thank you. You as well. Happy holidays, and thank you, veterans.
Hey, buddy.
Bye-bye.
Absolutely. Thank you for your service. Hey, we're going to go to a quick break. We come back. We've got more Ask the Experts.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.